Hello, my name is Dr. May. I'm very excited to welcome you to this interesting topic we want to look at today. Can arthritis be cured? It sounds like a question with an obvious answer. Because for you it's no. From experience, you have seen people, or even yourself, you are taking all kinds of treatments, all kinds of medications, and the pain instead is getting worse. So, why asking this kind of question? But what if I tell you that the answer is yes? Just relax. I'm not here to hype anything. I'm actually here to give a lecture. So at the end of the lecture, we'll see what your answer will be. For me, the issue with arthritis, or the problem with arthritis, is foundational problem. What do I mean? It's a problem that starts from the name. Arthritis is a compound name from two Latin words, arthro and itis. Arthro has to do with the joint, itis has to do with inflammation. So arthro and itis joined together is what formed the arthritis. So joint inflammation, that's what it means. Joint inflammation. This is how arthritis has been known and looked at right from the beginning. And this definition has guided the doctors in what they do along as treatment of arthritis is concerned. Are they right? Are they wrong? We'll find out later. Okay? When you present to the hospital, or when arthritis sets on in the joint, these are the 5 cardinal symptoms one might have. May not be all of them, but the typical symptom of inflammation is pain. So as we said, arthritis is joint inflammation. Every joint that is suffering arthritis will commonly have pain. Some might have swelling. If you are fair-skinned, you might have redness of the joint. Some might have, if it's so inflamed, when you touch it with the back of your hand, you might feel warm to touch. And if the pain becomes so severe, to use that joint becomes difficult, what we call loss of function. Okay? So these are the typical symptoms the person might present with. Even if you do not have others, the typical one you come with is what? Pain. And pain is a signal of what? Inflammation. Okay? So based on that, you'll be given these medications. And these medications are for pain. So the commonest one given or taken by people who have joint pain is the non-steroidal anti-inflammatory drug, the NSAIDs. And these are the typical painkillers, the common painkillers that are available we take. The diclofenac, the ibuprofen, and all those common painkillers. Then you have the steroid, that's where you have prednisolone, dexamethasone, or opioids. You have your tramadols. So these are the drugs that you might get if you want to go and buy, or the doctors might prescribe for you. And having taken these drugs in and out, and the pain persists, you can easily conclude that arthritis has no cure. All right? But let us really look at and see how pain is generated. As I always say, pain does not start on its own. Pain is always triggered by something, and is commonly triggered by tissue damage. So before you have pain anywhere in your body, there is a problem at that particular part of the body. So if it's in the joint, there is a tissue damage, there's a damage going on in that joint. So it's when there is tissue damage that the damage will not trigger the production of certain chemicals and enzymes. Typical of them is COX enzyme. Okay, the COX enzyme will lead to the production of other chemicals. Typical of them is prostaglandin. And these chemicals will lead to the production of pain and inflammation. And inflammation, as time goes on, we encourage more tissue damage. So there's a vicious cycle setting. So the more the inflammation, the more the tissue damage. All those drugs we mentioned earlier on are targeted at this spot. To do what? To reduce inflammation. But this is not where the whole thing started from. It started from here. Okay? So when doctors give medications, or when you have pain and you go and buy painkillers, or all those drugs you take, whether supplements, every drug you take to reduce the pain, look at where they act. This is the beginning of the whole problem. Now your NSAIDs start acting at this point to reduce the COX enzyme prostaglandin with the aim of reducing what? Inflammation. If it's the steroid, this is also where it acts. The opioids, all those drugs we mentioned, all of them acting beyond the root problem. So which means they are not even affecting the root problem. So as much as they try to reduce this, because the root cause is still there, it will be triggering them more. And as long as inflammation is there, it will be encouraging more of the tissue damage. Okay? So that's why those drugs fail. But what is the experience we usually have? The experience is because arthritis is actually two diseases in one. So it's a disease that has two components: inflammation and degeneration. And for what you have said previously, you have found out that the attention is here because it's believed that this is the problem in chronic joint pain, inflammation. Not knowing that there is degeneration, which is what we call the tissue damage. So this is what actually started the inflammation in the first place. But the whole attention is given to inflammation. But at early stages of arthritis, it works. So if you take medications, all those medications we mentioned, at the early stages of arthritis, you feel better. Maybe one day, some days, weeks, months, because at that stage, inflammation is the predominant component of the disease. Degeneration is mild. So if you reduce this inflammation to a BRS level, you feel fine. But because degeneration is there, it will still trigger it up. Okay? So that's why I continue to take those medications, exposing yourself to the side effect of those drugs like ulcer, kidney problem, and heart problem. But the problem is at later stage of arthritis, degeneration becomes the predominant disease. So this is the point your painkillers and all those your drugs are no longer working. From your common experience, you find out that you have been taking these drugs and you don't feel any better. And that's when you might conclude that arthritis has no cure. It's because all those drugs you were taking here and was relieving the symptom no longer relieve much here, because the inflammation that work on is now the smaller part of the disease. The degeneration, which is the damage of your cartilage and ligaments and tissues of the joint, has become the predominant disease. Okay? So, based on this new understanding, the definition of arthritis has been changed. Alright? Initially, it was defined as joint inflammation, which was very inadequate definition and had led to a lot of issues in the treatment of arthritis. And because of this limited definition, the treatment people receive don't work. So the real definition of arthritis, based on what we know now, is degenerative disease of the joint, which means a damaging disease of the joint. Yes, it is, because if you live, for instance, osteoarthritis of the knee, with time you might develop what we call K-leg or bow leg. It has deformed the joint. So it's a wear and tear, a progressive wear and tear. Just like when you pour an acid in a plastic, it gradually eats into it and destroys it completely. So arthritis can completely destroy the joint. So that's why it is not defined as degenerative disease of the joint. This definition has changed the treatment approach from inflammation alone to degeneration. Okay? So this is what I'm explaining. Now, yes, at the early stage, these treatment patterns can work: painkiller, rest the joint, exercise, warm and cold pack, and all that. They will bring down the inflammation. But when arthritis is established, you go to the hospital and the doctor makes a diagnosis of arthritis. No longer depend on this treatment pattern. You have to go for regenerative therapy, because the definition of the diagnosis of arthritis means that you are having degeneration in your joint. And the only treatment, the best treatment to treat degeneration is regenerative therapy. Another alternative is surgery. So without these two treatments, you are not actually treating arthritis. Therefore, I cannot say that arthritis has no cure, because what you are taking is not actually the treatment for arthritis. All right? So, yeah, so you have presented with your symptoms and the doctor sent you for test. And the idea of the test, just as I said, is to establish whether you have degeneration already in your joint and at what level of degeneration you are. Because degeneration is classified from stage 0 to stage 1, stage 2, stage 3, and stage 4. Okay? So, for instance, your complaint is in the knee and the doctor sent you for x-ray of the knee. The result comes out and the doctor is looking for features of degeneration. One of them is the wear and tear of the cartilage. Okay? So this is the bone of your thigh and the bone of your lower leg. And the space here is the cartilage between the two bones. This space here is wide enough, meaning that the thickness of the cartilage here is good enough. This has not suffered degeneration. But here, the cartilage here has suffered massive degeneration to the point that you can see just tiny space, meaning that the cartilage here is very thin, a thin layer of the cartilage. The bones are practically jamming each other. And not only the cartilage, the ligaments and other structures of the joint here will also be undergoing that process of degeneration. So, you might have started from stage 0, going to stage 2, like this person has gotten to stage 3 already. So these are the things the doctor will look at and see, or tell you that the cartilage has worn off. That's a feature of degeneration. You have osteophyte, bone cyst, sclerotic changes in your bone, and all that. So with this, the doctor's attention should be focused on treating this degeneration and not only the pain. Okay? So if it's in your low back or your neck, the spine, that the issue is, the best test is MRI, depending on the stage of how long it has been. So the MRI comes out and the doctor will be looking for features of degeneration in your spine, which include bulging of your intervertebral discs, herniation, impingement of the root of the nerves, and other features of degeneration. The bottom line, the doctor has established the diagnosis of degeneration. His attention now should be focused on the treatment of degeneration. If he's giving you medications for pain without giving you treatment for degeneration, as we mentioned earlier on, which are only regenerative therapy or surgery, the doctor is not helping your case. Okay? So that is it. So if you have been, the doctor has diagnosed you are having lumbar spondylosis, cervical spondylosis, osteoarthritis, or any kind of arthritis, and the doctor is still giving you medication, whatever medication it is, tablets, liquid, rub, whatever it is wrong. All of them are aimed at inflammation and not the degeneration. So if you are taking medications for a joint pain, you are not treating arthritis. You are just treating pain or relieving your pain. So some of us go to the herbal traditional treatments and buy concoctions and all that. That is wrong. It will not treat the degeneration. Some even go to all these people that use razor blades to cut your joints, saying that they are removing bad blood, that bad blood is the cause of your pain. It's wrong. There's no bad blood anywhere. Or else you have what is called hemaarthropathy, which means you are injured and blood is inside your joint and the doctor will aspirate the blood out. But generally, there's no blood causing you arthritis. So this treatment is wrong. Or, steroid injection into the joint. Steroids, as we mentioned earlier on, is a potent painkiller. Okay, but if you're habitually taking steroid will not regenerate the damaged cartilage or ligament. It will reduce the pain. As a potent painkiller, you might have relief for weeks, for months. But if you habitually continue to take the steroid injection, it further degenerates the joint. So if that diagnosis of arthritis have been made, whatever type of arthritis is it, your only options are two: regenerative therapy and surgery. These are options that treat arthritis and not medications and all that. So if you are not taking any of these two, you are not started treatment for arthritis. So you can say arthritis has no cure. All right? Great. So as I mentioned earlier on, the question is, how does regenerative therapy work? All the drugs you take, see the point at which they start working. It's only regenerative therapy that will start working at the root cause, which is the tissue damage. For instance, this is the person that having osteoarthritis and is receiving PRP injection. PRP stands for platelet-rich plasma, which is gotten from the person's own blood. Okay, when it is injected into the person's joint, the platelet will release growth factors which will start acting on the damaged part of the joint, the damaged tissues, to repair them. If this repair takes place, if the problem is treated at the root cause, all the pains and every symptom you have been having will all disappear. Okay, so the question, does arthritis has a cure? Now, arthritis, just like every other disease or chronic diseases, have two components: the disease itself and the symptoms. So the symptoms are those things you go to the hospital or to the doctor to complain: pain, swelling, whatever it is. Okay, so when you make your complaint, your doctor is meant to go a step higher to establish the disease or the cause of your symptom. If you have made your complaints and your doctor does not go further and gives you treatment for those complaints, like the pain and all that, the doctor is just trying to relieve your symptom. Okay, so it's when the doctor has made the diagnosis. For instance, in arthritis, he will send you for tests to make a diagnosis of degeneration. The doctor will now focus on treatment of the disease. So if you can treat the disease, which is degeneration, yes, you can cure the arthritis. But if you are treating the symptoms alone, you are simply getting a relief. It's a relief because it will still come back again. So treatment of symptom is not treatment of arthritis. Treatment of pain is not treatment of arthritis, but treatment of degeneration is treatment of arthritis. All right? So I'll leave you with these steps you should take. If you're interested in treating joint pain, if you're interested in living free from joint pain, if you're interested in curing your joint pain, let me use that word, you must go through these 4 steps. Okay? Number 1, visit your doctor. Many of us have the habit of going to the hospital, to the pharmacy or the chemist to buy drugs and all that because they know their complaint. My complaint is pain. You always visit the chemist to buy drugs for pain. By the time you continue taking those pain medications for a long time, you're exposing yourself to the side effects of those drugs, which includes ulcer, kidney problem, heart problem, and all that. So, as the saying goes, if the problem no better after 2 days of taking your own first aid, you can buy drug on your own. But if it doesn't get better, please go and see your doctor. So when you see your doctor and doctor listens to your story, which is what we call history, he might examine you to establish the diagnosis. If he's not convinced, he will not send you for tests. If it's arthritis, if it's joint pain, he will send you for tests like X-ray, MRI, or CT scan. Okay? So when that's step 2, when the result comes out, the doctor will now look at it and see whether degeneration has been established. If he makes a diagnosis of degeneration and tells you, madam or sir, you have arthritis in this your joint, he is simply saying that you have degeneration in your joint. That is step 3. The next step is to treat the degeneration. And just as we mentioned, your options are only 2. The treatment of arthritis are only 2: regenerative therapy and surgery. So if you are not having any of these, it means you are not yet at stage 4. And you cannot say arthritis has no cure because you have not tried the cure. Okay? So these are the steps. Let me know the step where you are. Are you at step 1 or step 2? Because it surprises me when people call in and I ask them, how long have you been having this joint pain? Some say 2 years, 3 years, 4 years. Have you done any tests like X-ray? No, I have not. And you'll be wondering, this person may not have seen a doctor. This person has been treating him or herself with painkiller. And that person cannot say he has been treating arthritis, and that arthritis will not go because that's not the treatment of arthritis. Okay? So you have to take these 4 steps for you to get healed from arthritis. Okay? So the question is, if I can repeat the question again, from what we have said up until now, what do you think? Can arthritis be cured? I'll leave the answer to you depending on what you have learned. So that will determine the answer you are going to give. All right? So, the truth is this. If you can heal it, you can cure it. Meaning, if you can heal the degeneration, you can cure the arthritis. And just as I said, depending at the stage of the arthritis at which you started the regenerative therapy. If you start at stage 0, wonderful. You can have up to 100% cure. Stage 1, stage 2, you can have almost 100% cure. But if you wait and delay and now come for the regenerative therapy at stage 3, stage 4, your success rate will be low. So the earlier one starts the correct treatment, the better. Do not wait until nothing works. Do not wait until all those drugs you have been taking are no longer helping. Even when the pain is going off and on, make a proper diagnosis. Start the treatment of arthritis early enough. Yes, because if you start early, that degeneration can be treated. And if the degeneration can be treated, the arthritis can be cured. Thank you for watching. I encourage you to share this lecture because there are many people out there that need to know. Many of us are perishing, are dying due to lack of knowledge. We are doing the wrong things because we do not know the right things to do. If you know the right things to do and do it at the right time, success is guaranteed. So let me hear your complaints, your comments at the comment section or in our various platforms. You can also watch us on Facebook on Arthritis Care Nigeria or Instagram arthritiscare.ng. You can also watch our previous videos and lectures even in our YouTube in Arthritis Care TV. Okay? Thank you very much. Hope to see you again in our next lecture. Bye-bye.